Hello YouTube, I'm Dr. Fox. Today, I'm going to talk about folic acid. Also called folate, folic acid is a B vitamin that supports the healthy development of the fetus, that is, the unborn baby, and helps to prevent neural tube defects or NTDs. More generally, your body uses folic acid to create new cells. Your hair, skin, and nails, as well as many other body parts, create new cells on a daily basis. In some countries, you find folic acid, which is a synthetic rather than a naturally occurring type of folate, in fortified foods including pasta, rice, certain breakfast cereals, and bread, and in the form of supplements. It is important to take a folic acid supplement every day when you are pregnant, as this vitamin is essential for the healthy development of the fetus's skull, brain, and spine, and as a result helps to prevent NTDs. Folic acid has the biggest impact when it is taken in the first few weeks of a woman's pregnancy, when a lot of women may not yet know that they are pregnant. So it's a good idea to start taking folic acid as soon as you start trying to get pregnant, or as soon as you find out that you are pregnant, and it's best to talk to your doctor about folic acid now rather than waiting. Okay, you may wonder, what are neural tube defects or NTDs? As a fetus develops, the neural tube is what will later become the baby's spinal cord and brain. This tube is supposed to close in the first 3 weeks of a woman's pregnancy. A neural tube defect is when this does not happen and the tube remains partially open. NTDs cause defects in the spine, skull, and brain, and this can result in lifelong disabilities for the child or in a stillbirth. The two most commonplace NTDs are anencephaly, where part of the baby's skull and brain are missing, and spina bifida, where the spine and spinal cord have not developed properly. If you are a woman of reproductive age who has or may want children, you should be taking 400 micrograms of folic acid daily to ensure you are getting enough folic acid to reduce the chances of certain birth defects should you become pregnant. You may not be thinking about children right now, but it is important to remember that around 50% of all pregnancies in some countries are not planned, and significant defects in the baby's spine and brain occur in the first month of pregnancy, when a lot of women don't yet realize they are pregnant. Importantly, taking more than 400 micrograms of folic acid daily won't necessarily do more to reduce the chance of NTDs developing, but if you have certain health conditions, your doctor may suggest you take a higher daily dose. If you have been pregnant or had a child before that has been impacted by NTDs and you are planning to get pregnant again, you should speak to your doctor. According to authority, women in this situation should take 10 times more folic acid every day, which is 4,000 micrograms, 4 weeks before getting pregnant and for the first 12 weeks of pregnancy. In sum, the best time to begin taking folic acid, while folic acid is vital for unborn babies, even if you are not planning to get pregnant, women who are of reproductive age should be getting folic acid daily to help them generate new cells. About places where to find folic acid, lots of food have folate in them, so eating a varied diet is good for your folate intake. You can also get folic acid from vitamin supplements. Remember, the recommended daily intake of folic acid for women is 400 micrograms. Supplements are widely available and you can find them in pharmacies and supermarkets. The label will tell you if the supplement contains 100% of the folic acid you need each day. You can also get folic acid from fortified foods. Corn, masa flour, and some types of bread and breakfast cereals will have folic acid in them. Check the nutrition label on the packaging. Fortified foods will have 100% written next to folate. Finally, you could do a bit of both and take a supplement that has some folic acid in it, as well as consuming fortified foods. As of taking higher doses of folic acid, Women who are at higher risk of NTDs during their pregnancy may be asked to take 4 mg of folic acid every day for the first 3 months of their pregnancy. You could be at higher risk if you or the biological father of the baby have an NTD or there are NTDs in either of your families, or if you've already had a pregnancy that has been impacted by an NTD, or if you are diabetic, or if you are taking any anti-epilepsy medications. If you are at higher risk, it is important to see your doctor so they can prescribe you the right dose of folic acid. Moreover, your doctor or ObGyn may advise you to get extra tests throughout your pregnancy to look for any problems. However, if you have not been advised by a medical professional to take more than the recommended daily dose of folic acid, you should stick to this dose of 100 micrograms. In particular, don't take more than 1 mg of folic acid each day unless a doctor has told you to. Okay, thank you for watching. See you soon.